Sino yung mga pasyente ko nga pala dito? One? Only one? Ikaw na dumating out of the many? Sige. Anyway, you might be wondering how come a surgical oncologist or a doctor like me is joining direct selling. I'm already quite successful in my direct practice, but I'm here for the product. Actually, I believe in the product, that's why I'm here. No? Kung successful ako, bakit ako magdi-direct selling? Mas malaki yung kinikita ko sa pagiging doktor ko. I joined this company, it's because of, not probably of the added income, that's just secondary for me. I'm here to tell you what my experience are, with regards to transfer factor. Kaya ako naging lecturer. Okay. So, I'm here to discuss the evidence base. We doctors always believe that there's always evidence. Dapat may ebidensya bago namin i-prescribe into our prescription form. So, ito yung isi-share ko sa inyo. Sa pagiging doctor ko, my specialty is oncology, surgical oncology. So I treat cancer most of the time, cancer patients. And the primary treatment for cancer is really, tatanggalin mo. The mother tumor has to go. And if merong anak-anak, we call it metastasis, we treat it with chemotherapy. As you know, chemotherapy, daghan side effect ba? Unsang side effect sa chemotherapy? Tanggal ang buhok. Hair loss is one. Bakit may hair loss? Welcome, please come in. Dito, makante pa to dito. Ayan. Francis, mas mahal ang bayan dito sa Francis, ha? Sige, welcome. You're just on time kasi kaka-start lang. So I was discussing about cancer treatment. Primary treatment is always extirpation of the primary tumor, which is surgery. And chemotherapy is just the added treatment. Kasi ang cancer magduduga, kalat na, nag-anak-anak. We can remove the mother tumor by surgery, pero yung mga anak-anak niya, hindi maraming kaya operahan yan, isa-isa yung mga anak-anak niya. We treat it with chemotherapy. Ini-inject yun dito sa ugat. Pag punta sa buong system, you get all the side effect of chemotherapy. Hair loss, vomiting, pati yung mga red blood cell, white blood cell, bagsak lahat yan. Because chemotherapy acts on everything. Lahat pinapatay niya. Good cells and bad cells. But with my experience dito sa transfer factor, ang mga good cells na pro-protectan. One of the dreaded side effect of chemotherapy is my febrile neutropenia. You know what is febrile neutropenia? Febrile, ibig sabihin may fever. Neutropenia, ibig sabihin ng neutropenia, bagsak yung WBC. Kaya before chemotherapy, ginagawa namin ng CBC, complete blood count. Hi, good afternoon. Please take your seat, madam. You're always present here every time I have a lecture. How many are second timers, third timers? Memorize yun na yung aking lecture eh. Wala nang suspense eh. No? Anyway, welcome pa rin. I hope you can master my lecture so that you can cascade it to your downlines, no? The next time around, ako na lang uupo dyan, makikinig na ako sa inyo, okay? Several times na kayo nandito eh. So as I've said, chemotherapy, one of the dreaded side effect, which is nakakamatay, febrile neutropenia. May fever, ibig sabihin may infection, the neutropenia, bagsak yung WBC. Kasi pinapatay niya lahat ng cells, pati good cells, bagsak. That's why WBC goes down. If you have infection and your WBC, which is soldier of our body against infection, is down, unsa na lang ang protection sa lawas against infection? Wala. That's why ako na nakapatay sa pasyente sometimes during chemotherapy. You know the famous actor, rapper, Francis Magalona, si leukemia last time, di ba? Kinamatay niya hindi leukemia. He died from the side effect of chemotherapy, which is pneumonia. Pneumonia is infection of the lungs. Kaya bagsak yung WBC niya. Wala siyang protection, kaya he died from sepsis. But with my experience, I'm going to share with transfer factor, very nil or very minimal na yung pasyente ko ay nagkaka-febrile neutropenia. 2 years ago, before my knowledge of transfer factor, medyo I should admit, I have quite a few patients who had febrile neutropenia. Even 1 or 2 patients died from it. have to admit na, because of febrile neutropenia. But now with transfer factor, nil or very, very nil yun na nagkaka-febrile neutropenia. You know, pag nagkaka-febrile neutropenia during chemotherapy, anong binibigay ko? We give injection of filgrastim. Filgrastim is GCSF, granulocyte colony stimulating factor, GCSF. Per injection, that's almost 6,000 pesos para tumaas yung WBC. We give it every day for 3 days. 6,000, 6,000, 6,000. How much is that? 18,000. Then we give antibiotic 2,000 3 times a day. 2,000, 2,000, 2,000, 6,000 times 3 days. 18. 18 plus 18, 36 na. Wala pa yung professional fee ko. Wala pa yung hospital room rate. So kulang-kulang 50,000 every time you have fever during chemotherapy. That's why I explain to the patient, sige ka, if you don't take transfer factor and then you have fever during chemotherapy, then we do CBC, bagsak yung WBC mo, yung febrile neutropenia, that's what I will give and you spend 50,000. Ano gusto mo? You spend 50,000 or you just spend 3,000 plus 1 bottle a month and you're safe with it. That's why it's easy for me to convince my chemotherapy patient to take transfer factor. Kasi that's what my experience is. Okay. If chemotherapy is added treatment, adjuvant, we also give radiotherapy. Sometimes we do surgery, there are microscopic cells na naiwan, radiotherapy is the option there to prevent recurrence. And of course, that's always the miracle prayer. And now my latest armamentarium in treatment of cancer is immune therapy. I believe there's a role for natural healing within your body. You yourself can treat cancer. Your body. Why is it that this person doesn't have cancer and this person nagkaka-cancer? It's because this person na may cancer, immune system niya is weak. Hindi nakaka-fight against cancer. I'll show you some slide later on na meron pati cancer ina-atake ng white blood cell. So, kaya ng katawan natin labanan ng cancer. It's just that sometimes your immune system cannot recognize it. That's why hindi niya ina-atake. So, ito ngayon yung immune system. Paano unsa man ang immune system? Depensa sa unsa. Kagaw, no? Infection is one. Infection, viruses, bacteria, fungal, and even cancer cells. Our immune system can fight cancer. So, sa mga itong part sa immune system nato, we have the tonsils. Yun pala nagtotonsillitis tayo. Natural defense pala ng katawan natin yun against infection. Meron kang nakain na dumi. That's why your tonsils get enlarged to filter the bacteria. Even the lymph nodes in the neck, mga lusay-lusay na rin sa liog. Kaya sometimes even catching cough and colds, lumalaki yung lusay mo dito. Yung mga bata, maraming lusay dito sa likod. Kung sa mana. Very good. Doktor ka. Ayun, doktor. Primary complex is lymph node enlargement dito sa likod ng mga bata. They are exposed to TB. That's why a lot of children you're not a Filipino if you're not exposed to TB. Ano pa yung mga lymph nodes natin dito? Pati dito sa appendix. No? Appendix is one of our lymphatic system, even the spleen. So the most important cell actually of our lymphatic system, gusto ko lang matanda ninyo, never mind all these things. This one, NK cell. What is that? Natural killer cell. So just remember this, natural killer cell. Yan yung pinaka-importanting cell sa immune system. And I'll be talking about this later on. Sample, cartoon figure lang ito. Ito yung white blood cell natin, or our immune cell, which we call the macrophage. Ito yung cancer cell. Ang gagawin ng white blood cell, or our immune cell, is to eat it. The medical term is phagocytosis. No? Kakainin niya. Pag nilamon niya yan, tinunaw niya, he digested it, and what happens are just the antigen of that cancer cell. Ito yung naiwan doon. And this antigen will be presented into the receptor and present it. Balik, kumbaga, flag niya yan. I have won the war. This is my trophy. Ito yung trophy niya, pinipresent niya dyan. This actually will be shared into the other cell. Paano kung siya lang nakakaalam yan? Kailangan i-share niya sa ibang cell para yung ibang cell mag-attack dun sa cancer cell. This antigen will be presented into that receptor site so that it will be shared to the other inactive o yung ibang cell na hindi pa nakakaalam na yung cancer cell dapat pala i-attack. Do you know why cancer cell keeps on growing and growing? Hindi lumiliit. A cancer cell is an immortal cell. There's something wrong with the genetics actually. They just keep on multiplying and multiplying. They are immortal. They do not die and yet they multiply very fast. Kaya laki ng laki. Then what happens, hindi sila namamatay, hindi pa sila lumiliit, hindi pa sila inaatake ng immune cell because they are not recognized by the immune system. The immune system thinks that these cancer cells are our body's own cell. Actually, they are our body's own cell. Cell man natin galing sa katawan yan. It so happens it is not recognized by the immune system, that's why it is not attacked. But if once it is attacked, it is recognized, this antigen will be presented in the receptor and it will be shared to the other inactive cell. The information is shared. Once shared, they release the cytokines. Actually, itong cytokines na to, yan yung transfer factor. This is the information code which will be shared to the other cell. They now have the information. Once they have the information, they will be also shared, they multiply and share to the other cells. They can now attack and recognize the cancer cell. That's how a WBC, a cytotoxic T cell, attacks a cancer cell. Okay? They will also present an enzyme which we call perforins. The perforins will perforate the cell wall and cancer cell, they die. They die by apoptosis or programmed cell death. Then they can now attack another cancer cell. Cartoon lang yan. Sa totoo, ito yung picture ngayon. Here is a cytotoxic T lymphocyte attacking a cancer cell. Ito yung cancer cell. Actual ito ha. Malaki yung cancer cell. Here's a cytotoxic T lymphocyte. It secretes all those perforin enzyme. It perforates the cancer cell, and the cancer cell shrinks. Namamatay yung cancer cell. That's the way a body should attack cancer cell. Unfortunately, sabi ko, hindi nare-recognize ng immune cell yung cancer. Bakit kaya? Kasi nga, ang akala ng immune system, cancer cell is our natural own cell. It needs the information. So where should we get that information to tell the immune system to attack the cancer cell? Tatlong beses na yun. So in a military model, the transfer factor, I was pointing about it, is an information molecule that teaches the immune system, tinuturo niya dun sa immune system, how to see, recognize the threats and things that become disease in our body, such as cancer or infection, and directs the immune system soldier to attack and kill it. Kahit na infection yun or bacteria, kaya pa rin niya labanan. Mas mabilis na ma-recognize. Kagaya nito, infection ito. This infection is what you call Trichomonas vaginalis, a very common protozoa that causes UTI sa mga babae yan. Ito yung mga Trichomonas vaginalis. These are flagellates, they move around. And here is your WBC attacking, sinusundan talaga niya. Pag lumalapit doon, nilulusaw niya yung Trichomonas vaginalis. So infection is better controlled if you have the transfer factor to help it recognize and kill the infecting organism. Kaya yung sino ba dyan frequent ang UTI, nakailang antibiotic na kayo, una, trimethoprim sulfonetoxazole, naging quinolone, naging cefuroxime, ano pa ba yung mamahaling pag-UTI na gamot. Halos lahat, oral, hindi nyo kaya, injectable na. You try to add transfer factor to it. No? I've tried it on my patient, mas mabilis ang control ng UTI. It's because your immune system is not working. It's not only the antibiotic. Alam niyo ba sa antibiotic, there's such a thing as resistance.
Yes.
Once you always take that antibiotic, the organism or the bacteria will now know, uy, yun pala yung antibiotic na tinitake mo, ha? Afterwards, you take that antibiotic, hindi na gumagaling. It's because it's already resistant. But transfer factor, it actually educates your immune system, and your immune system will attack it. There's no such a thing as resistance there. So actually, transfer factor was discovered by this old man. His name is Dr. Sherwood Lawrence in 1949. During that time, ang prevalent to na parang cancer is TB. Pag may TB ka, parang may cancer ka na nun because there's no known cure. Ngayon pala, ang gamot lang tabletas na lang. No? Sana later on, ang gamot din ng cancer, tabletas na lang. Actually, they're coming out with it, no? Cancer cure in the form of capsule. But it's still very expensive. It will cost almost 500,000 a month just for that one batch of capsule. The newer drug now against capsule, it's almost 500,000 a month. Capsule na lang, very effective, very specific, less side effect, but very expensive. Kasi bago pa siya. But sooner or later, when it becomes more common, or the patent is already off patent, magiging mura na yan siya. Because it's very expensive to discover a drug. Once they discover it, it would take millions of dollars. That's why they have to recover their investment also, kaya ang mahal. So this old man was making that discovery, ano kayang cure against TB? So what he did was actually supposing, may mukhang TB hunter. Kunyari kayo, may TB kayo, no? You have TB, tuberculosis, and you get the blood, extract the, sa blood kasi mayroong red blood cell, white blood cell, and the plasma. Yung white blood cell lang ang kinuha niya. He extracted the white blood cell, and then wash it, then inject it to this person na hindi pa exposed sa TB. So yung white blood cell, kinuha dito siya sa pasyente na may TB, and inject it to this person na wala pang TB. And he noticed that after injecting this person with the white blood cell from this TB patient, this patient, when exposed to TB, hindi natatablan. Hindi nagkakaroon ng full-blown of the disease. No? There was transfer of immunity from this patient to the other. And he called it transfer factor. Hindi pa niya alam anong tawag nun eh. So there must be a transfer magic daw. So he just called it simply as transfer factor. And now, they now recognize that yun palang transfer factor actually is nakukuha pala sa gatas. They just look at the gatas. And there's such a thing as transfer factor there. That's why DOH recommends breast milk is good for babies. That's very true. Because the mother's immunity is transferred through the breast milk. Especially the first breast milk that comes out. Yung mga dirty looking na breast milk. Unang piga talaga. That's what you call in medical term as colostrum. Yun, that contains a lot of the transfer factor and even immunoglobulins. That's why babies na uminom ng colostrum, hindi masakitin. No? Hindi madaling magkasakit. Unlike babies not fed with colostrum, they easily get sick, madaling mahawa. No? They're thin, they're emaciated, because wala silang immunity. So we can get it from breast milk. Alangan naman, lahat ng mother, kukunan mo ng colostrum, wala nang maiwan sa baby. So scientists discovered that the colostrum of cow and the egg yolk of chicken contains a lot of this transfer factor. So through a patented technology, ibig sabihin ng patented, exclusive yan. Have you seen other direct selling companies selling transfer factor? Wala, exclusive lang yan, for life lang ang meron. So kung ikaw distributor, you can say that we are the only ones who have the patented technology of filtering the colostrum from cow and egg yolk from chicken and make it into a capsule form. They freeze dry it, and the patent is for 17 years. And here's the certificate of patent in the United States. So exclusive, kayo lang meron. Here are the dairy farms in the US. Makita mo high-tech, malinis. Ito yung mga cow. Ito actually yung mga cow na black and white. We call that Angus beef. Masarap yun. Very expensive, right? One steak is how much? 1,000 plus yan, isang order. Ito yung mga Angus beef. So these are the farms, the grade A dairies. And you can see their quality control, malinis talaga. So why don't you just drink the colostrum instead? Meron pala sa colostrum eh. Yung mga cow na bagong panganak, kunin mo yung colostrum, yun ang inumin mo. Do you think it would be better? Colostrum contains water, minerals, vitamins, protein, fat, carbohydrate, immunoglobulin, and even hormones. But do you know that one capsule of transfer factor, isang capsule is equivalent to 2 liters of colostrum. Magkano yung 1 litro ng gatas na Magnolia? 16. So 2 litro, magkano yan? 120. So the actual costing pala of 1 capsule of transfer factor capsule is 2 liters of fresh milk. Imagine, if you take 1 capsule 3 times a day, minimum lang yan, 1 capsule 3 times. So how many liters of colostrum should you drink? 6 liters. Ayun, magkaigit-igit ka din yung colostrum mo. Eh kung 5 capsules 3 times a day, ilan na 15 capsules a day, so you have to drink 30 liters of colostrum. Kung may makuha ka pang colostrum ng cow, can you drink 30 liters a day? Na magutod ka na diyan. That's why the transfer factor that is contained here is exclusively pure. It's pure. It does not even contain, kunyari allergic ka sa milk, di ba meron mga ibang lactose intolerant, they do not drink milk. This does not even contain lactose. Kaya hindi ka, kahit na lactose intolerant ka, you can take this one. That's why this one is more recommended. Okay, next. So transfer factor, actually it is made up of 44 amino acids. It is a highly effective immune messaging system. It comes from cow's milk, colostrum, yung unang bigat talaga, and the chicken egg yolk. It's designed by nature to become the critical immune information. So transfer factor is not a vitamin. So don't advertise it as a vitamin. It is not a mineral, not an herb, not an antioxidant, not a hormone. It's not even a drug. What it contains in the capsule is the information. So it's a protein molecule code information. Once you take it, it activates the immune system. Once your immune system is activated, it can now fight, it can now recognize bacteria, protozoa, viruses, and even cancer. So actually, ang transfer factor, ito yung microscopic picture ng isang transfer factor. It has three segments. Ito yung first segment, second segment, and the third segment. The first segment is the one which you've seen kanina, yung dinidisplay na flag sa receptor. Okay? Feel free to take those. Medyo for free yan sila para makatikim kayo. What is Riovida? Riovida is the liquid form of transfer factor. Okay, feel free. It's for free. Habang libre, the best things in life are free. Go ahead. So ito yung kanina sinasabi ko, dinidisplay as a flag. No? What do you call that? This is the antigen-specific function. This is an array of critical tags used by the immune messaging system to identify the host. That's why sabi ko kanina, pag meron na siyang tag, meron na siyang flag, WBC can now recognize the cancer cell kasi nakatag na siya. No? Recognize na siya. Ito namang middle segment is what you call the suppressor segment, suppressor function. What is the suppressor function? Down-regulates the immune response once the threat is defeated. This is also true in allergy, asthma. Unsa man ang asthma? Once you're exposed to pollen or dust, bigla kang hahatching. May hatching, hindi ka na makahinga. Because your immune system is hyperactive. Sobrang OA na po na yung immune system. Konting exposure lang sa pollen, hyperreact, it releases histamine. And histamine will constrict your bronchioles. Once it constricts, kasi gusto man niya i-constrict para di mo malanghap yung pollen. That's a natural, God designed it that way actually, no? The immune system is too protective of the body. Once na malanghap niya, nakatake a little pollen, masyadong baka makapatay yan. So what it does is release histamine, and histamine will constrict the blood group. Dili ka makahinga. Natural defense yan ng katawan. But actually, pollen cannot kill naman talaga. But if you take transfer factor, it will educate your immune system. Pollen lang yan, hindi yan makakapatay. So, it decreases the attack of asthma. Pansin nyo yan. Kung sino yung may allergic rhinitis, allergy, asthma, no, skin asthma, if you take transfer factor, mas lesser ang attack, or sometimes even, mawala na yun. The third segment is what you call the inducer function. Ito yung pangatlong segment. It triggers a general state of readiness of the immune system. Ano ibig sabihin niya? Ito yun. Naturally, once you're exposed to, let's say, flu virus, that's day 0. On the first day, tataas yung mga complement system. These are the tumor necrosis factor, interleukins, the interferon alpha. Yun yung magti-trigger ng NK cell. Ano yung NK cell dito kanina? Natural killer cell. Once the NK cell is triggered, that's the time you get well. So once you have a flu exposure, may fever ka, you're down in bed, you get well usually on the third day. Diba? Flu, pahinga ka talaga, mga 3 araw ka down. But once you take transfer factor, this is what will happen. And the cytokines are released on the first day, so it's only on the third day that the natural killer cell will start killing the virus and get well. But if you take transfer factor, day 0 pa lang, taas agad yung cytokines mo. There's a ready immune system that is working. Kick off ka agad siya. That's why the complement system starts at day 0, and after 1 day, you get well. That's very true. I've experienced that. Yung mga anak ko, 0 absence sila sa school. It doesn't mean that if you take transfer factor, you will never get sick. You will. But once you get sick, you easily recover. Yung mga anak ko, may fever, pag uwi, may fever, no? Mainit. So I give them an extra dose of transfer factor. They have fever, they go to bed that night, they just rest. Huwag na muna mag-study, rest na muna. The following day, the fever is gone. They go back to school right away. That's true. I've experienced this several times. No? Ma-expose man sila sa flu, they get the fever, but the following day, they're up and about and they go back to school. Ready ka agad yung immune system mo. So actually, here's a study done by the company. They want to see if secretory IgA, which is an immunoglobulin found in the oral cavity, kung tumataas pa siya if you take transfer factor. Actually, 95% of infectious organisms enters our body through the mouth. The mouth is very dirty. No? Kasi lahat ng pumapasok yan, sometimes germs, bacteria, pumapasok through the mouth. So the main protection of our oral cavity is what? Ito yun, secretory IgA. Once a bacteria gets in, it is acted upon by secretory IgA. So gusto malaman ng kumpanya kung kumakain ka ba ng transfer factor, tumataas ba yung secretory IgA. So here is the study. Secretory IgA is the most abundant immunoglobulin found in the body. It is produced 3 to 5 grams per day. So if there is failure of secretory IgA to block the organism, what happens? You get sick. Kasi hindi niya na-block it. Dumiretso yung bacteria sa loob. But if you have enhanced secretory IgA, very effective yung blocking system mo na immunoglobulin sa mouth, you don't get sick. Correct? Alright. Here's the molecular picture of a secretory IgA. It is an antibody. It is found in the mucous membrane, especially the mouth. It is produced 3 to 5 grams per day. And what does it do? It is the first defense of barrier against infection, especially the mouth. Sige, pasok kayo. Please come in. Meron bang naka-reserve dito? May reserve seat. May VIP pang dadating. Wala na. See, there's one more seat here. Meron. Sige daw, may B.A.M.S pang darating. Wow, it's full pack once again. Medyo matagal-tagal na kasi ako hindi na pang-lecture. I promise to do this twice a week at least. No, not twice a week, twice a month. Dati once a month, ngayon siguro twice a month para mas maraming makakarinig. Okay, let's continue. So the objective of the study is to determine if secretory IgA increases if you take transfer factor. So what did they do? They have 24 subjects, 24 adults, and for 3 weeks, these 24 adults were taking 4-life transfer factor trifactor and 4-life transfer factor Riovida, so 2 liquid, saka yung blue na transfer factor. And every week, salivary collection was done to determine kung tumataas pa yung secretory IgA. So ito yung result. Ito yung baseline, day 0. Then after 5 weeks, ito yung pula. So nakita mo lahat ng after 5 weeks, tumaas ano? After 5 weeks, itong pula. Ito yung baseline, 110. After 5 weeks, 191. There is 73% increase in secretory IgA. So that means if you take transfer factor, your secretory IgA in the mouth will increase. That means better protection against bacteria, correct? Baseline, ito lang kakonte. And after 2 weeks lang ha, 2 weeks lang. 2 weeks, ganito nakarami ang secretory IgA. So result, statistically significant increase in secretory IgA in as little as 2 weeks. So if you take transfer factor capsule in just 2 weeks, it should be effective. But for my patients, let's say I want to downgrade a tumor, I try it for 1 month. Just to be sure, but actually for this study, 2 weeks pa lang pala may result na. Ito naman, NK cell. Ano naman ibig sabihin ng NK cell? Natural killer cell. So, this study was, ang tagal, no? 11 years. They did it 11 years. Ang dami ang 3,624 adult subjects. Ang result, if you have high natural killer cell activity, what should be the result? Low cancer risk. If you have low natural killer cell activity, the better chance of getting cancer is you should have a low NK cell activity. So if you want to have cancer, you should have low cancer NK cell activity. So which is better, low NK cell or high NK cell? High. Everybody wants to get high NK cell. Paano mag-high ang NK cell mo? Percentage increase in immune activity, NK cell activity. This is transfer factor, ordinary. Another transfer factor, 200. But the transfer factor for life, which is transfer factor advanced, there is increase in NK cell activity by 283%. And the transfer factor plus, I think the best product is really in dark blue. This is transfer factor plus. Transfer factor plus, it increases the NK cell activity by 437%. Imagine that. This is interleukin. Interleukin is an injectable form of, galing sa WBC yan. Per injection, that is 5,000. And you have to be injected every day to get 389%. So 5,000 kada adlaw, you get 389%. So ito, capsule lang, iinumin mo lang ng capsule, you will get higher result. 437% increase in NK cell activity. So if you have high NK cell activity, cancer is down. That's why you should take this one to prevent or minimize cancer. Hindi yan sabi ko, study nila yan, 11 years. Ito naman, this is according to JANA test result. JANA means Journal of American Nutraceutical Association. They have a 7-year study on 198 products, ang daming ingredients. And top 8, ito yung mga top 8. Noni, di ba uso yun yung noni juice? Saan ba galing yung noni juice? Anong tawag ng fruit na yan?
Noni plant.
Noni fruit, apapot pa yung tawag doon. Apatot. Baho, no? Noni juice. Uy, 15% lang man i-increase niya na. Aloevera. Ano ka? Sabi nun na, forever living, Aloevera. So, 15% naman di ay. Bovine colostrum, 23%. Oh, meron din isang produkto dyan, ang daming mushroom. The coffee contains all kinds of mushroom there. Shiitake mushroom, 42% lang. Echinacea, 43%. But look at the transfer factor advance. Itong advance is the light blue, 283%. And the plus, which is the dark blue, imagine, 437% increase in natural killer cell activity. So this is so far the best in the market. Advance, 389%. Interleukin pala to, 389. Then the transfer factor plus advance, 437%. This one, you have to be injected every day, 5,000 per injection to obtain 389% increase. While this one, you just take the capsule, you get even higher result. Sa Russia, they tried giving transfer factor in their inpatient. No? And they noticed na yung sa mga hospitalized patient nila, ang bilis ng recovery. That's why they make it into their law that transfer factor be available sa pharmacy in Russia. So if you go to Russia, you happen to be admitted there, transfer factor is available in their hospital pharmacy. Unfortunately, dito sa Philippines, sa sobrang strict ng BFAD, lahat ng food supplement, bawal. Kailangan palagyan ng no approved therapeutic effect. Lahat ng food supplement, it is a law only in the Philippines. All countries around the world, all food supplement, according to the Philippine law, should have a label, no approved therapeutic label, para ma-approve. Otherwise, you should have an under-the-table, no approved therapeutic label. Yes, that's the Philippine law. No, that's part of it. As you can see, it's very effective. Even in the States, no, sa physician's desk reference, transfer factor is available there. So now I'll talk about evidence-based medicine. The doctors would really need this, no? I'll just share to you what evidence-based medicine is. It aims to apply the best available evidence gained from the scientific method to the medical decision-making. So ibig sabihin, before a doctor writes a drug or a certain prescription, it should have evidence-based. Ano pa ibig sabihin? Dapat may ebidensya, for sure. For life, meron silang 11 doctors. These are all renowned doctors in their medical advisory board. 2 even are oncologists. Dr. Townsend are gynecologic oncologist, and Dr. Yes, pareho sila OB-GYN oncology. And ilahang chief, si Dr. Carl Muslan, who happened to be here last year, April, siya nag-inaugurate nito, kaya nandito siya. Tangkad, okay, Amerikano lahat yan. Ito, Amerikanong hilaw. Okay, so levels of evidence, there are 3 levels. Level 1 is RCT, or what we call randomized controlled trial. Ang ibig sabihin lang yan, randomized controlled trial. The one doing the study of that drug doesn't know kasi randomized. Hindi niya alam which patient is taking which drug. So, hindi siya bias kasi hindi niya alam, you know? He base it according to the result. Pag level 2 naman, randomized, medyo may bias konti kasi yung the one who's making the study knows which patient is taking which drug. So may konting bias ito. And the third level is level 3, basing on expert opinion. I would say, oh yeah, I'm an expert in that. That is a very good drug. That is expert opinion. Bias yan. Eh kung binayaran yung gumawa ng study, so sabihin niya maganda na yung drug, di ba? Unfair. Testimonies from your kapitbahay, from your friends, are also called level 3. So among the 3, which is the best? Level 1, kasi randomized siya, no? Walang bias.
Yan din yung double blind study.
Yes, double blind is even better kasi blinded siya, hindi niya alam, no? Walang bias. Sa categories of recommendation naman, pag sinabing category A recommendation, Kunyari, there are 10 doctors in the panel of experts, 75 would agree that the drug is effective. Pag sinabing level 2, category B recommendation, controversial yan, 50-50 doesn't agree. So, hapik sila. And if it is category 3 recommendation, do not take the drug because they have disagreement that the drug is effective. So, the best is category A. Level of evidence, level 1, category A, and sa phase of study naman of a certain drug, we have phase 1 which is in vitro. Ibig sabihin ng in vitro, laboratory pa lang yan, Petri dish. Tinatry doon sa Petri dish, kung effective. If it is effective, we try it on laboratory animals, rats, monkeys, mice. If it is effective, we go to the phase 3 which is the human study. So the best phase of study is phase 3. So we're looking for studies or journals in the medical study that it should be level 1, category A, and phase 3. So ito testimony. Testimony is considered level 3 evidence lang. So ang dami ng mga testimony that transfer factor is effective daw. But it's only level 3. Bias siya. Kasi sabi ng kapitbahay. Do you think there are people who shouldn't be taking transfer factor? I've been talking about how good transfer factor is. But do you think there are some people who should not be given transfer factor? For those who have been in my lecture before, do not answer. To keep the suspense. For those first-timers, you can answer. If you can answer, I'll give you another glass of Rio Vida. So there are actually some people who should not be given transfer factor. Who are this? Yun. Transfer factor cannot be consumed by those with organ transplant. So kunyari may kidney transplantation. Yung kidney, hindi man galing sa kanya, galing for other people. So from other people, they're given a kidney, they're taking immunosuppressant para hindi nila i-reject yung kidney na binigay sa kanila. So this patient is taking immunosuppressant, and here you are, binigyan mo ng immunoactive, and what happens? The immune system becomes very active, ni-reject na yun yung kidney. Naku, sayang yung 500,000 worth of surgery. Pati yung kidney na reject, sayang. It's because of your fault. Yeah, do not give this to organ transplantation. But actually, do you know what? Organ transplantation during the first few months, because they're taking immunosuppressant, a lot of them die from sepsis or infection. The mortality is not due to rejection, but due to infection. A lot of them die from infection and sepsis. Grabe ang infection yan. Because they're taking immunosuppressant. They suppress the immune system so that hindi nga ma-reject. Hindi nga ma-reject, namatay naman sa infection. Too bad. So just remember, don't give in to organ transplantation. So here are some of the studies which I've searched in the journal. Chemotherapy in pulmonary tuberculosis. Now we know that because the first patient who actually benefited from transfer factor was a TB patient of Dr. Lawrence. So although this is level 2, category B, successful treatment, severe complicated measles, tick dust. Although level 2, category B lang, I'm using complicated measles. Some babies which are weakling, immunocompromised, they have severe measles, they die from pneumonia. But if you give transfer factor, you strengthen their immune system to survive according to this study. This is done in Mexico. Treatment of childhood Epstein-Barr virus, EBV virus, and cytomegalovirus infection. These two viruses are very common causes of diarrhea. Pag yung mga babies, nagtatain, they try to give transfer factor. Ang bilis ng recovery. Without taking antibiotic. Because your immune system works, ito na yung magpapagaling sa kanya. With antibiotics, sometimes you get all the resistance there is. And who knows, you give antibiotics is for bacteria. Yun palang cause ng diarrhea niya is a virus. Mali pa rin. You give an antibiotic which is not antiviral. Mali. And these are viruses. So you give antibiotic, it's not intended for that. But if you give cancer factor, the immune system works, it kills virus, bacteria, fungi, kill all siya. Effect on non-specific acting cancer factor on juvenile rheumatoid arthritis. Actually, juvenile rheumatoid arthritis is an autoimmune disease. Ano ibig sabihin ng autoimmune disease? Your own body creates the antibody against your organs, such as the mga joints mo. No? There's antibody against that. That's why you have bata pa, nagkaka-arthritis na, rheuma na. So probably with this one, this is an autoimmune disease. What is the best to suppress that? Suppressor? Transfer factor, advance. So the light blue, just remember, this one is very good for allergies, asthma, autoimmune disease, the light blue. Ito naman plus, if you want it for infection, for cancer, this one is good. Okay. I went through the Medline abstract search. Sus, ang dami na pala mga study. Actually, there are thousands. These are some of the more important ones that I highlighted. Ano ba dito? Okay. HIV or AIDS. You know what is AIDS? Acquired immune deficiency syndrome. So the patient is suffering from immune deficiency caused by this HIV. Ano ibig sabihin HIV? Human immunodeficiency virus. From the word ng immunodeficiency, definitely ang makakatulong is something that would enhance the immune system. The virus destroys the immune system, but your transfer factor builds the immune system. So very good ito. Kaya HIV ngayon, bihira na yung namamatay unless fulminating infection yun. But if you give this to enhance the immune system, plus very good drugs against the virus, medyo nagsusurvive na. They can just be a carrier and the disease is stable. So now, hindi na masyadong problema yan. What else? Even this one, no? Allergic bronchial asthma. So what is the best transfer factor? The light blue. Because of the middle suppressor segment. It suppresses the hyperactivity of the immune system. Eto, mas interested ako dito. Transfer factor in malignancy by Dr. Pisa. This is level 2, category A. Ito yung mga cancer na pinag-aralan niya. Lung cancer, bone cancer, melanoma, which is cancer of the not skin, mole, alum, melanoma. Medical term, we call it melanoma. Papillomatosis, nasopharyngeal cancer, very common yung nasopharyngeal cancer of Chinese descent. May bukol yan dito sa loob na palang cancer. Burkitt's lymphoma. Lymphoma are cancer of the lymph node. Cervical cancer. Do you know that cervical cancer meron ng vaccine ngayon? Yes. Because cervical cancer, 70% of them is caused by the virus, HPV, human papilloma virus, which causes ulugo, wart, but not specific wart, it's a genital wart. Once you have genital wart and you have sexual intercourse, you transfer the virus to the partner. The partner will have wart. If you have HPV infection in your vagina, in your cervix, you will have cervical cancer. So now if you get vaccinated against HPV, 70% of the time you are protected against cervical cancer. So women 9 years old to 65 years old, you can get the 3 shots of cervical cancer now. Even men, recommended na rin. Yung lalaki, kasi kayo ang source ng cervical cancer virus. So pati kayo, mabakunahan na rin. Yun ang recommendation niya to prevent cervical cancer. Hodgkin's lymphoma, this is also cancer of the node. Renal cancer, cancer of the kidney. Bladder cancer sa pantog. Prostate cancer, ang dami, no? Even leukemia, even fungal infection, nakakatulong daw ang transfer factor plus according to Dr. Pisa and his studies. So here, metastatic prostate cancer. Prostate cancer usually metastasizes or nakalat na sa bones, which is very painful. According to Dr. Pisa, effective daw ito. It's already level 1, category A, phase 3 study. Non-small cell lung cancer, level 1, category A, phase 3. Bakit ba yung husband na smoke ng smoke ang nakaka-cancer yung wife na hindi naman smoker? Have you seen that? No? Yung husband, sige smoke. Pero yung wife na hindi nag-smoke, yun pang nagkaka-cancer ng lung cancer. Because the wife inhaled the secondary smoke. And her immune system is weak. That's why siya pintang nagka-cancer. The husband has a stronger immune system, kaya kahit ma-smoke siya ng smoke, hindi siya nagka-cancer. I'm not telling you to smoke and take transfer factor. So, the moral lesson there is build up your immune system to be protected against lung cancer. Nasopharyngeal cancer, also level 1, category A, phase 3 study. Even chronic active hepatitis. Ang mga tao takot sa hepatitis ba? Alam niyo bakit? Patay, basi namatay sila. Kaya hepatitis, takot sila. Chronic active hepatitis, they say that nakakatulong din daw ang transfer factor. Even head and neck tumor, head and neck cancer, very common. I don't know why very common sa Philippines ang goiter. And we also have a high incidence of thyroid malignancy here in the Philippines. Sabi nila, lack of iodine. But the Philippines is an archipelago. Ang dami nating seafoods dyan, which is a rich source of iodine. Bakit tayo nagkaka-goiter? Probably it's autoimmune character. So which is the best? This one. Non-bacterial female cystitis. This is very common cause of UTI. As I've said, UTI, transfer factor plus. Even herpetic keratitis. Eto. This is a clinical study conducted by doctors on stage 4 cancer patient. When you say stage 4, the cancer has spread usually to the liver, lungs, brain, bones, kalat na siya. And the life survival is usually less than 6 months. We don't want to say that, no? Lalo na kung sasabihin mo sa patient would ask me, Doc, stage 4 naman kaya ako, how long do I have to live? I always tell them it is not mine to answer. It's always the one up here who tells you your time is up. I'm going to get you now, no? I always don't give the date. I don't tell them na, you have 6 months to live. Lalong hindi kakain yan, lalong namamatay ng maaga yan. So they conducted this on stage 4 cancer patient. So after 6 months, usually they have 3.7 months to live, but after 6 months, here's the result. 16 out of 20, which means 75% are still living after 6 months if they take transfer factor. That's very true. I've experienced that sa mga stage 4 cancer patient ko. Sometimes I thought 6 months, namamatay na. Almost 1 year, 2 years, buhay pa. Nakakapagtaka. Kaya I've seen wonders already with this product. That's why I'm here talking to you today. Otherwise, if I don't see it work, I wouldn't be here convincing you to take it. First and foremost, you have to experience it in order to transfer your experience to your recruits. Ito naman, meron diabetes, yan, mga ganyan. Pag mangingitim na yung tuhod, mga paa, usually, when you go see the doctor, we would get a knife and chop it off. Chop-chop na yan. But this lady took transfer factor. At you know, there's a product for life against diabetes. Ano yan? Glucose. Okay. February 12, March 8, 3 weeks lang ha, gumaling yung kanyang non-healing wound. There's revascularization, gumaling. Very good. Yung secretary kong isa, diabetic din, she has one like this in the foot. I gave her glucose. After 1 month, naging ganito na. So, naniniwala din ako na it worked. This patient naman has a severe, quite rare, we call it ulcerative colitis or Crohn's disease. Oral manifestation yan. But taking transfer factor in just almost 1 month, wapang siya. Ito naman, si Mr. Ronald has a severe infection of the hands. Usually we go to the ER, pag ganyan, chop-chop na rin yan. He took transfer factor, probably with antibiotics also, in just 1.5 months. This gumaling, hindi na chop-chop yung kamay. This patient had shingles. Shingles is the cousin of chicken pox. Once you have chicken pox, hindi ka na magkakaroon ng chicken pox ulit. You will have the cousin, which is shingles or herpes zoster. And it usually affects one dermatome. Ganyan, sometimes masakit na masakit yan because it infects the nerve. Nerve ang ina-atake yan, kaya masakit yan, shingles or herpes zoster. So this patient took transfer factor in just 4 days. Gumaling na yung kanyang shingles. Viruses, transfer factor is really very effective against viruses. After transfer. Plus is good for infection, cancer. The advance is good for allergy, asthma, autoimmune diseases. Ito sa paa. Gumaling din. Usually, mga ganyan na, chop-chop na yan. Buti na lang, plus, kasi infection. As I've told you, I was a skeptic before. Sino ba naman doctor sasali ng direct selling? I don't like to recruit actually. No? But I just believe in the product. That's why I asked you to come here if you're my patient. So I was a skeptic before. And I deal with breast cancer a lot of times. So here's my patient 2 years ago which operated on mastectomy. Ito yung mastectomy scar niya, tinanggalan ko ng suso. And then, she underwent chemotherapy surgery na yan. Eh, chemotherapy siya, yung pinakamahal pinili niya, tag 60,000 per cycle. For 6 cycles, that's how much, 360,000. She underwent radiation. Medyo advanced na kasi kaya nag-radiation din siya. Radiation is how much? 86,000 pesos. She also underwent hormonal, but during that time, wala pang transfer factor yun. Ha? So ito, after 2 years of chemotherapy, hormonal therapy, radiation, nag-recur pa rin. Probably it's her immune system that is really weak. So ito yung recurrence, nakita niyo yung mga bukol-bukol na yan. These are all recurrence. Hindi ko na kaya operahan yan. Alangan, laplato ni mo to buong chest wall. So I just did a biopsy of one of the nodules, tinanggal ko itong nodule, just to confirm kung tulubang breast cancer. So the biopsy came out to be invasive ductal carcinoma, so recurrent yun. We did a hormonal study, it's negative, so hindi siya pwedeng hormonal tablets. Hindi pwedeng hormonal tablet, chemotherapy ang last recourse niya. Yung sinabi ko na, the only treatment now is chemotherapy. Umiyak na siya, Dok, ayaw ko na talaga ng chemo, Dok. Bakit wala kaming pera? Meron naman, Dok, pero hirap na hirap daw siya. Buti na lang, Mr. Moises Abuan, who was very kulit at that time to recruit me, sabi ko, sige nga, mag-iwan ka nga ng sample. So he left with me 1 bottle, which I did not mind. Nilagay ko lang doon sa shelf. Almost 1 or 2 months din yun sa shelf. Nakita ko yun, binigay ko sa patient. Sabi ko, this was given to me as a sample, you might as well have it. So I tried her 5 capsules 3 times a day. Ilang capsules yan in a day? 15. 5 before breakfast, 5 before lunch, and 5 before dinner. After 1 month, bumalik na naman. Nakita ko na yung patient card sa table ko. Naku, ano naman kayang gagawin nito? Ano naman kayang complain? Doctors do that also. We think before you come in our clinic, naku, ano naman kaya ito? Sige, tinawag ko na, intercom. Okay, papasukin na. Nung pumasok niya, kapag Dok, this is what happened. Salamat, Dok, at binigyan mo ako ng transfer factor. Alam ko talaga na she is not taking other drug. There's no other medication. She was not on chemotherapy, dahil ako naman nag-chemo. She only took transfer factor, 5 capsules 3 times a day. After 1 month, no, naugatan na. This is before and after. In just 1 month, her immune system worked and she had a cure. That's why I became a believer. Ito yung pusat namin, transfer factor. If it works for humans, it might as well work for cats. Yung aming Persian cat, one day, ayaw na kumain, nakahigat na doon, no, nagtatay, nagsusuka. I gave her 1 capsule lang ang nilagay ko sa food niya. Her favorite is tuna, yung naka-canned good pa na tuna. Nilagay ko doon, kinain naman niya. The following day, she was up and about. So if it's good for humans, it comes from animals anyway, it's also good for animals. Actually, one of the presidential diamond, sino ba yun?
Taas daw, gitna.
Ito, no? She is Dr.
Makyang.
Makyang. He looks old. Okay. Si Makyang. Ano siya, veterinarian. He gives it to his mga dogs daw din. So what else? So here are our products. Ito yung the best we have in the market. Ito yung top seller natin, Transfer Factor Plus. Very good for infection, for cancer. Ito, this is very good for allergy, asthma, autoimmune diseases. We have the cardio for cardiac patient. If you have hypertension, ischemic heart disease, yung mga bypass candidate, this is very good. Kasi ang testimony naman ito, iba-bypass na sana, take dito. Kung i-check, i-angio, wala na yung mga clogs. And this one, glucose, is very good for diabetes. If you have facial cream, face wash, this also contains transfer factor in the form of lotion, ointments, and so forth. Then ito, pang bata. Children cannot take the capsule form, they can take the liquid form. 2 tablespoons once a day for kids. I recommend 3 times a day for my cancer patient. Once you open it, put it in the ref. When you put it in the ref, ilagay mo sa taas. Bakit ilagay mo sa taas? Kasi kung mababa, baka binuksan ng bata yung ref, binuksan, ilagyan ng straw at inubos yung isang bote mo na patay, 2,100 ubos. So kailangan i-refrigerate ito. Ito naman in sachet form, when we go abroad, we bring this one. Isang bukas lang at inumin na. So light blue, very good for allergy, asthma, psoriasis, yung mga ganun, autoimmune diseases. And the liquid form for the kids. Some ladies even take this one because this contains acai berries. At yung mga berries niya, yung dami niya berries, acai berries, pomegranate, blueberry, elderberry, purple grape, apple. All these are pampaganda daw ng skin. So some ladies take the transfer factor Rio Vida for beauty purposes. But these are also good antioxidants. And the blue is for infection and for cancer. It contains all these. Yung transfer factor plus advanced. Okay, so if you want to take the transfer factors seeking balance, downregulation, allergies, autoimmune diseases, take the like transfer factor advanced. Transfer factor plus is for stimulation, infection, cancer prevention. Cardio for cardiac patient, hypertension, and even bypass candidate patient. Glucose for diabetes. Ito naman, spray. Available pa naman ang spray dyan, ano? 7 sprays equivalent to 1 capsule. So ito yung beauty product natin. Pag nag-abroad kami, ito yung ginagamit namin kasi kailangan ng facial ointment. So the recommended treatment, daily dose, 1 capsule 3 times a day. If you're sick, you can take 2 capsules 3 times a day. With chronic ailments, 3 capsules 3 times a day. For terminally ill, you need aggressive treatment. You need to downgrade the tumor. 5 capsules 3 times a day. Okay. Thank you for your kind attention. Okay.
Maybe we can spend a few minutes question and answer. Any questions you'd like to ask? Mayroon kayo tatanong or nasagutan during the presentation. Any questions? Just raise your hand. Yeah.
Okay, nakalagay din dyan sa label, ha? Not recommended for pregnant women. But actually, it is pwede. Sa Philippines lang kasi, meron tayong law. If you don't have a study yet on it, it should not be, nasa label talaga, not recommended for pregnant women. My wife is an OB. She gives it to her pregnant women. Maganda rin, lalo na yung mga buntis na frequent ng UTI. Mas mabilis gumaling. Pwede. Any more question? Yes.
So, yung ano Doc, yung open and valve sa heart, bata kasi 8 years old. So, okay lang din ba yung mag-take ng ano?
When people ask me about anatomic defect already, my question pa na, Doc, ang bungi ba? Those are anatomic defect already, no? Kung baga na yung bungi, your chances of closure ng bungi is very nil, no? You need surgery probably. Okay? When you recommend transfer factor, do not promise heaven and earth, o pag mag-take ka ng transfer, hindi ka na mamamatay. No, not that. When you take transfer, you will also get sick, but recovery is faster. When you take transfer factor, the chances of having cancer, because your NK cell is higher, chance of cancer is lower. Huh? Ganun dapat ang explanation. And since I've been taking transfer factor, the chances na magkasakit ako is nil. No? Yes.
Good ba siya for
Thalassemia, blood dyscrasia. Yes. Do you know Dr. Jenny Ong? Yeah, hima-on ko siya. So I told her to give this to her patient. She has personally tried it and nakita talaga niya sa bone marrow smears na dumami yung mga plasma cells. Nagulat na siya bakit dumami yung plasma cells. Ibig sabihin, ang bilis ng recovery ng patient. So I think it would be beneficial also to patients with thalassemia because blood dyscrasia din yun eh. So Jenny, Dr. Jenny Ong, bibigay na rin ito. Kasi yun na-experience niya sa bone marrow smears, he has never seen so much plasma cell in her bone marrow smears. Yun ang comment niya. Tapos yung kanyang kinikimo din na patient, yung mga bata na may leukemia. There was one who came into my clinic na umiiyak na dahil almost every month they get admitted because of low WBC count. So I told you, febrile neutropenia, how much you spend? Malaki, no? Since that little girl was on transfer factor, she never had an admission during that time. So they came back to my clinic, pasalamat na, last month. They never had admission na of febrile neutropenia. Maganda talaga. The best really is the plus. But kung ang patient meron allergy, asthma, the advances for that.
Do we have an actual trial?
Yes, dengue also. Dengue is caused by the virus, no? Carried by the mosquito. So, meron kaming mga, although wala pa talaga study, pero may mga experiences na tumataas ka agad yung platelet. Nakaka-recover ka agad. Kaya mabenda, hindi na mamatay. Polyps, pwede mo i-try yung plus. Meron akong mga pasyente na operahan ko na dapat. Because the husband was my chemo patient, so I gave transfer factor for the husband. And here comes the wife who comes along with the husband. Na-diagnose ko meron yung parotid tumor dito. So I was supposed to be operating on her a month after. But she took transfer factor after 1 month. Nung operahan ko na siya, schedule na dapat flatten out na, nag-normalize na yung kanyang parotid tumor na wala. Walang tuloy ako ng operahan. Dosage. If you want to shrink a tumor, you want the best dosage. It's 5 capsules 3 times a day. At kung nagtitipid ka, as little as 1 capsule 3 times a day is okay. After 2 weeks, you reach the nadir or the plateau of your blood levels of transfer factor. So after 2 weeks, I would suggest you can taper it down. 5 capsules, 3 capsules after 2 weeks for the day. My trial dosage is for 1 month. I want to see if it is really effective or not. For 1 month, I give the high dose of 5 capsules 3 times a day. Rio-Vida 2 tablespoons 3 times a day for 1 month. After 1 month, the patient comes back to me. Kung nag-shrink ang tumor, shrinkage of the tumor, feeling of well-being, mas masarap ang pakiramdam niya, mas nakakatulog na siya. If there's pain, there's lesser pain, those are clinical signs of response. So, pinapa-continue ko. Pero kung wala talaga, I tell them to stop. ay mahal good dito, hindi naman masyadong mura yan. So I tell them to stop. Transfer factor is not for you. Meron din cases na no effect. Probably the immune system is really haywire, no? Na talaga nag-effect. Yeah, don't promise heaven and earth. Just tell them it will work good for you. If it not, then probably transfer factor is not for you. Carol.
I had a couple of people that took maybe a little bit more than they needed. You know, more is always better in people's minds. So what happened is they started having something that I found a little paper that we've been given on, what did you say? What are you talking about? Yeah, healing crisis. And I followed your lead and I Googled healing crisis and found 79 pages of articles on healing crisis. And I was just wondering if you bumped into that.
Yes. Yun yung na-experience, Carol here is a nurse, and she gave transfer factor to her patient. There's such a thing also as healing crisis. No? First few days when you take transfer factor, your immune system is hyperactive. So kung saan yung may problema, it directly goes to the area of injury or area of problem. So you might experience a little more reddening on that area, a little more pain. That is usually for a few days lang. And after that, you have complete healing. So tell them, kung lalong sumakit for a few days, it's just a normal phenomenon. That's what we call healing crisis. And after that comes healing. So don't worry when a few days after taking transfer factor, there will be severity or mas grabe na nafe-feel mo. Normal lang yun. That's what we call healing crisis.
Drink a lot of water.
Drink a lot of water. Yes. Just tell your patient it will get well.
Question. I have this client who has PTB stage 4. The x-ray showed that both lungs were all white, and the doctors told him that they could not do anything. So I started him on 5 capsules 3 times a day, and he has been taking transfer factor for almost 2 months now. His last x-ray was last December, and he's asking me if he could have another x-ray. Actually, he tapered down his dosage to 3 capsules 3 times a day plus 1 cup of 30 ml Riovina a day, just to maintain the transfer factor milligrams level at 1 day. So he's asking me, Mom, could I have myself, could I subject myself to x-ray? I said, I don't know, I have to ask the doctor.
Yes, he should. No? Para malaman niya kung may response o wala. If it is pure white, then probably meron na konting black doon. No? There's aeration already.
Another question.
Good thing, if he is still alive, that means good response na yan.
Actually, he looked better.
Imagine stage 4 na completely white, sabi ko, dapat mamamatay yan. Tapos white pa, that means may response.
The problem that he has right now is that every time, even he's expectorating so much phlegm, and he moves out so much phlegm. And he said because of the too much phlegm, he gets he has a difficulty in breathing because it's just coming out even if he doesn't want to make.
Give him more water because water is the best mucolytic. Yung mga phlegm na matitigas, may labas na. Those phlegms are actually dead tissues yan, no? Na nilalabas ng katawan. Probably mga patay na bacteria yan lumabas na doon sa phlegm. Normal yan sa TB na may ganyan. But if he should do well, mawawala yan. Okay, so I'll give the floor back to Moises to explain.